208,606. Our 7-day rolling average now is at 187. Unfortunately, we do have 2 new deaths to report this evening, which is a tragic reminder that this pandemic is not over. We're getting there, but it's not over. So please keep those who have lost a loved one in your prayer tonight. We have lost too many of our friends and family members to this disease. There are 199 COVID-19 patients in our hospitals this evening, and over the last 24 hours, there are 27 new admissions. 84 patients are in the ICU, and 26 are on ventilators. Let me move now to Commissioner Clay Flores.
Thank you, Mayor. Hi, I'm County Commissioner Rebecca Clay Flores, and I'm happy to report that Bexar County Hospital, UHS, hit a huge milestone today in the fight against COVID in administering over 300,000 vaccinations as of today. Yesterday's number was 6,747 doses. In addition to Bexar County Hospital UHS continuing vaccinations at the Wonderland Crossroads site, we are excited to be partnering with colleges in order to afford easier access to encourage all adults in our community to get vaccinated. Bexar County Hospital UHS opened a vaccination site today at St. Philip's College on the east side and administered 1,000 shots. We expect to vaccinate 5,000 people a week here. Hours are Monday through Friday, 8 to 5, and from 3 to 5, we will accept 250 walk-ins daily. You can sign up at wecandoitsa.com. That's wecandoitsa.com. In the county's effort to vaccinate some of the hardest hit and most vulnerable areas, we will also be partnering with Texas A&M San Antonio on the south side for a date in the near future. As far as Texas allocations, the federal government will be sending about 8,000 more Pfizer shots next week than we received this week. But the amount of Moderna vaccines are the same for next week. And Johnson & Johnson is still limited, and we continue to try to get more of those. Please continue to wear your masks as we work to get our entire community vaccinated. And do not wait for a certain brand. Please go get vaccinated and take the shot that's afforded to you. Thank you.
Great. Thank you very much, Commissioner. And I also want to say thank you to our Defense Department and our Veterans Administration, who has also been vaccinating in our areas. And if you include the vaccines that they have been administering to our veteran community, we now have 622,382 folks in the Bexar County area that have at least one dose of the vaccine. So in cooperation, the city, the county, and our VA are doing their part to make sure we can get vaccinated. So please, as the Commissioner said, get your vaccine as soon as you're able. Now, to go to our frequently asked question of the day, I'm going to pose it to Dr. Wu, and the question we are receiving is, can I get vaccinated against COVID-19 while I am currently sick with COVID-19?
Well, we wouldn't want our vaccinators to get sick, but as soon as you are no longer needing to be in isolation, which for most people is 10 days after your positive test result or after your symptoms started, then you absolutely can get vaccinated.
Great. Thank you, Doc. And as always, you can get the latest on COVID-19 in our community by texting COSA.gov to 55000 or by going to the website covid19.sanantonio.gov. Also want to remind you that if you're struggling to pay rent or mortgage through this pandemic, there is an emergency housing assistance program available for you. You can get more information there by calling 311. And finally, if you're out of work and would like to train for a job that's available today in our community while you receive a stipend to make ends meet, you can get more information by calling 311 or enroll in our Train for Jobs program at 210-224-HELP. And as always, please continue to do your part. We are putting this pandemic behind us by working together. Please continue to mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Myself, the doctor, and the commissioner are available for questions.
I know you both weighed in on this previously, but could you comment on Governor Abbott's statements about the Migrant Resource Center at Freeman Coliseum?
Well, I'll just say, and then I'll hand it off to the commissioner, that these are very serious allegations to make, and they need to be thoroughly investigated. It has been our approach, even though this is a federal operation, that the welfare of these children are of the utmost concern. So they need to be thoroughly investigated.
As a former educator, we know that when we deal with children, it's very delicate and sensitive. And of course, any accusation needs to be investigated. We need to let the officials who are trained do their jobs. It would have been ideal when dealing with children that instead of having a press conference to hurl around accusations, investigations, facts, and evidence should have been taken care of before a press conference.
Commissioner, could you discuss the details of your tour that you took after his press conference and the governor was along apparently, and would you please do so in Spanish?
You want to do it in English and Spanish or just Spanish?
That'd be great.
Sure. So, we heard that the governor was coming to do a press conference, so I have spent my entire life striving to be a voice for the voiceless, of which these children are definitely a part of that group. So I went to see what he had to say. He hurled his accusations, and then I, out of respect, allowed him to leave, and then I went up and said my piece. It's my understanding that he was not going to tour, but in the press conference, I talked about, how one can make certain accusations without touring. So then later, they entered in to tour. So I accompanied him in as well. While we were waiting for the results of our COVID shots, we had a very pleasant, non-political conversation for quite a while. He was very gracious during the tour. He thanked the staff several times. The students, I'm a former educator. The children stood and gave him a standing ovation twice. And he had plenty of time to speak with medical staff and the caseworkers and ask all the questions that he wanted. It did not appear, from what I could hear, that he was asking any kind of specific questions based on the accusations that he hurled around. Ayer el gobernador tuvo su conferencia de prensa y dijo muchas acusaciones. Entonces, después que él terminó, yo fui también a hablar de mi experiencia allí, no solamente como política, pero también como voluntaria. Y yo mencioné que cómo él puede hablar en que yo pienso, chismes, sin había entrar para un tour en el Coliseo. Entonces después ellos también entraron para un tour, yo también entré y el tour fue muy amable. Él tuvo mucho tiempo para hablar con los doctores allí, la gente, hacer todas sus preguntas. Fue muy amable. Dio las gracias a los trabajadores, los voluntarios y los niños allí le dieron un muy fuerte aplauso 2 veces.
Comisionado, ¿considera usted que usted ya ha estado ahí como voluntaria? Estuvo ahí cuando estuvo, por ejemplo, el juez Nelson Wolf, estuvo el alcalde Ron Niederberg también. Entonces, la pregunta es, ese día ustedes salieron y dijeron, nos sentimos bien de las condiciones en las que están los niños. Ayer se dijo que no se les estaba dando de comer bien, que estaban mal atendidos. ¿Usted acepta ese tipo de conclusiones del gobernador?
Claro que no, eso es algo que yo digo que es el fake news, que son mentiras, porque el gobierno federal tiene el contrato allí y han contratado con 3 restaurantes aquí locales que dan de comer 3 veces al día a todos los niños más 2 snacks. Tanto que cuando yo fui como voluntaria con mi iglesia, que estuvimos bromeando con los niños, que espero que no se hacen gorditos mientras su tiempo aquí, porque están comiendo demasiado, y los niños dijo que la comida está rica también.
Commissioner, is there a message that you would like to send to the mothers and family members of the kids who might have heard about these allegations? And if you could do it in English and Spanish again, please.
Sure, that this is not a political issue. It is a humanitarian issue, and children should not be used as political pawns. We as adults have a responsibility to protect children of any country in any age, to provide for them protection, shelter, food, and access to free public education. I trust that the authorities who are trained will do their due diligence and investigate. In the meantime, we as a community will continue to support children who have come to knock on our doors, pleading for needs.
Could you,
Repeat the question again.
could you say that in Spanish, please?
What was the question again?
Oh,
The message to the
yeah, the message to the mothers and families of those children.
Sí, claro que niños no deben ser usados como un juego político y solamente para usar como chisme, que nosotros como adultos tenemos el deber de proteger a cualquier niño de cualquier país y que este no es un juego político, pero es algo humanitario y tenemos el deber de darle la protección que ellos necesitan.
Have either of you or any of y'all heard anything, any new details about the investigation?
I'm not privy to that information.
I have not.
Who is in charge of the investigation?
I'm not privy to that information. Like I said, I am from the stance that we should allow the trained officials who have that authority and know what they're doing to do their jobs. So, of course, it is a federal contract. It's a federal program. The governor has, obviously wanted the Texas Rangers, but then, of course, there's local boundaries. So I think that they can duke that out amongst themselves and see who's the head in that investigation.
Commissioner, we talked a little earlier with HHS in regards to the process it's taking to reunify these children with parents, guardians, sponsors, etc. Have you heard any more about how the process is going? Because originally we were told that most of the boys would only be at the emergency intake site from 3 to 9 days. Today's obviously day 10.
I have not heard. My understanding is that some children are starting to be reunited. Obviously, it's a long and difficult process, and I know that there are a lot of caseworkers, and they are doing the best they can. So, of course, our hope is that we will continue, as more kids come, we will continue to usher out more children.
Switching over real fast to the vaccines, we've seen more and more coming from the federal level to the state level, therefore to the local level. How much assistance has that been in being able to schedule more people? Because we heard that more Pfizer vaccines are coming in the coming weeks. We've heard, an increase every single week, it seems like recently, when it comes to how many the state is getting.
Yeah, I mean, we get more vaccines, we schedule more appointments. That's how it works. To this point, though, we have not been receiving the share of doses that we think this region is justified. Despite that, though, I would credit again to the vaccine administrators at the public health labs, our Metro Health Department, the county, UHS, and all the private clinics around. The vaccines that we are getting here at Bexar County are going into arms a lot faster than we've seen in other cities.
We're not getting more than a week's heads up, though, so that still makes it hard to plan.
That's all we have tonight. Thank you.
Thank you.